the energy that you bring to work every day is the energy that everybody around you is going to pick up on and start to exude. And that's going to be then the energy for the patients when they walk in the front door until they leave the practice. And so, one of the things that I always say to everybody who's working for me and myself included is that, everything matters from the moment that the patient comes into the office to the moment that they leave, and even when they're outside of the office. They see, hear, and feel everything. You have to really believe in what you're doing. You have to believe in, the type of medicine that's being practiced, how everybody's working together, the workflows that you're creating. You want every single member of the team to feel equally valuable, because every single component of that workflow is equally important, right? By having that oversight and guidance is really important so that you can stay on track. And then I always say to my patients, like, my goal for my patients is not for them to lose weight. It's to lose weight and keep it off. Because if you lose weight and regain it, you're not getting all the benefits of losing the weight, right? Most people can do anything for a short amount of time, right? You could cut quesadillas out for 2 months, but eventually you're going to want a quesadilla again. One of the fundamental components of medicine that is challenging is that there's a bottleneck with how many patients I can see. So I can only see so many patients per day. I can only reach so many patients. I'm a human being, so I have limitations, right? However, I can expand access to a lot of the things that I think are really meaningful and can move the needle for people's health through this app. And so that's one of the reasons why I'm particularly excited about it, because I think that there's a lot of good data that just tracking alone can help move the needle and move outcomes with overall diet and lifestyle change, which is quite hard for a lot of people. And so I'm very excited about that.
Hello, 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 everyone, and welcome back to Scaling Practice Management, the show where we help practice managers grow smarter, not harder. My name is Jakub. I'm the head of marketing at Talkie AI, where we help medical practices stop the phone from ringing off the hook and unburden their front desk team with our AI medical receptionist agents, and we're already helping over 300,000 patients every month. And my guest today is Dr. Elizabeth Edens. Dr. Edens is the founder and medical director at Health Meets Wellness, a medical practice specializing in weight management and integrative medicine. I was practicing the pronunciation of integrative and I got it done, so that's cool. Dr. Edens is also medical director at TouchCare Method, a unique all-in-one digital platform for evidence-based weight loss and metabolic health. Dr. Edens, welcome to the show. So nice to have you.
Oh, thank you so much for having me. I'm excited to be here.
Yeah. Have you done one of these before, or?
I've done a podcast before, but this is my first time doing one that's really specifically for I would say, like, managing the practice of medicine or for practice managers. So I'm excited that there's a slightly different audience and a different lens that we're kind of looking at medicine through.
Okay, yes. That is definitely the lens of the show. I typically tell, our guests coming on that if you had a room of 200 practice managers, what would you say to them? We're going to talk about that definitely and share relevant advice. But first, before we get into business, I have a little bit of a game to play with you. I'm going to, for the first question of the show, before we talk about practice management, anything else, I'm going to give you 3 categories. Each category is a question. You pick the category and you'll get the question. So the categories that I chose for you today are fun, childhood, and weekend. Which one do you want?
Weekend.
Weekend. Okay, so the question is, what does a perfect Saturday look like for you?
Ooh, okay, good. I love this question. So a perfect Saturday would be spending it with people that I love, so friends, family, being outside and being active and having a little bit of time for myself in terms of like reading or a little time for yoga, meditation, some introspection, and then cooking.
Okay.
Mm-hmm.
Awesome. So being active, what does that mean for you? Is it a walk or something more intense?
I do like walking. Walking, I think, is one of the most underrated forms of exercise, but probably it would be
Okay.
something like going for a run, maybe playing some golf now that the weather's getting a little nicer. So something active.
Oh, so you're a golfer. Cool. And for
Yeah.
reading, what have you been reading recently?
I'm actually reading a book called Seabiscuit. I don't know if you've read that book before, but
No, I haven't heard of it.
it's great. It's great. It's about a racing horse named Seabiscuit. You should read it.
So it's a fiction book then.
No, nonfiction.
Nonfiction. Okay. All right.
Yeah.
Cool. So, how do
Yeah.
you pick up a book like that? Is that recommended by Opera these days, or?
It is actually a very, yeah, it's a well-known book. There was a movie that was made as
Oh,
well. Yeah, yeah,
okay.
but,
Okay. Cool.
it's really
Cool.
good. Yeah, yeah. It's an amazing story. So it's yes, it's about the horse, but it's about everything else, around racing at that time. It's a little bit of a, history, of the country and, life and, the energy and zeitgeist of things when Seabiscuit was racing, and a little bit about horse racing culture, and yeah, it's interesting. It's really good.
Okay, awesome. See, I love it. I love that. Thank you for sharing that. And that's, I always make it a point on the show, on this show that I run, and I did it on previous shows as well too, because often we launch into the business side of things so quickly, and it's important to remember that we're people too. We have passions, we have hobbies, and we have fun Saturdays too. Thank you for answering. That was a good one. I'm glad you picked that one. And moving on.
Wait, what about you? What do you do on Sat what's your perfect Saturday?
My person, I suspect that I might get this back launched at me. I also do like walking. I've been trying to get back into the habit of reading, but unsuccessfully thus far. Definitely spending time with my friends. Board games, a board game evening would be great. There's this awesome board game called Terraforming Mars, quite popular. It's what's in the name. You play cards and you kind of place stuff on a board to turn Mars from uninhabitable to, raising the temperature, the oxygen level, placing oceans on Mars. You play it in with like four people, and one game takes like 3 hours. So, yeah,
Wow. I'll
it's
have to check
extremely
it
fun.
out.
Yes, definitely. Okay, so we'll put that in the show notes, your book and my board game, and that'll be the resources for the washes and isters for today. Amazing. Thank you. Thank you for asking it back of me. So now to continue the questions coming your way, Dr. Edens, you're getting the question that everybody gets on the show. It's a tradition, it's a classic. What is your number one tip for successfully growing a healthcare practice? Let's launch into it.
Yeah, yeah. So I love that question because it's hard to pick one thing, right? There's so many things that
Mm,
you'll learn when you launch a healthcare practice. But I think, there are a couple of things. One, the energy that you bring to work every day is the energy that everybody around you is going to pick up on and start to exude. And that's going to be then the energy for the patients when they walk in the front door until they leave the practice. And so one of the things that I always say to everybody who's working for me and myself included is that, everything matters from the moment that the patient comes into the office to the moment that they leave, and even when they're outside of the office. They see, hear, and feel everything. So you really need to have a cohesive team that is integrated and working as a team so that the patients feel comfortable, cared for, and also that there's that attention to detail so that, they have a really excellent experience. That's really how you can build your brand in your practice.
I love that. I definitely like that answer. So there's a couple of threads to pick on here. One is, okay, you're mentioning these moments that are so important, that every moment is important. It definitely rings true. Which one or which few do you think are the most overlooked moments that practice managers should care about more?
I think one of the maybe overlooked areas is, patients come late because they're people,
Hmm.
right? Things happen in life before they walk in the door. They sometimes then have to wait when they get there. Sometimes, care is delayed because one visit bleeds into another visit into another visit. There's just the way that medicine is, no matter how planned you are, no matter how much of a buffer you put in
Of
between
course.
patients, this is the way it goes. So I think one thing that's overlooked is just how to make that time valuable for everybody and how to use that as an opportunity to do different things in the practice to make that time, I would say, positive as opposed to negative. I'll give an example. If you have patients that are waiting in the waiting room, make the waiting room engaging and exciting. Give them stuff to do in the waiting room. Put QR codes for things they can download, things they can look at, not just magazines, but things about the practice. So for example, our practice, we have a mobile app, and we also have a supplement brand. So for all of our patients, if they're waiting in the waiting room, they can start to look at some of the brands, some more components of our brand. They can start to look at our supplements. They can start to look at our app, they can start to get engaged and do things that we may have actually done during the visit anyways. So then they're already primed for the visit, but also they're doing something that's engaging and exciting while they're waiting. And then, you're waiting 5, 10 minutes, you don't really notice. Right. So little things
Yeah,
like that. The other thing I would say is that, one thing that I don't know if it's always overlooked, but one thing that I do think is critical is having everything ready and prepped for the day. So that will help
I
just
know.
make everything go smoothly. Like how you start the day will shape the entire ethos of the practice and the clinic in the sense of like having all the rooms cleaned, prepped, stocked, everything like that. Like those little attention things that are attention to detail, having lists, the checklists that you make sure everything is done every day really, really helps to move the needle. They sound simple, but they really will make a difference.
I totally subscribe to that thinking. Have you read the book, The Checklist Manifesto, by any chance?
It's funny, I haven't read it, but I've heard good things about it.
Yeah, yeah, that's definitely the philosophy that's in this book, that it so much can be improved with just a simple checklist, like start of day, end of day checklist, etc. So if anybody thought that, they should do more of that, that's a great book to read.
Yeah, I don't know if I don't know the specifics of the book, but I can give one anecdote, which is that surgery as a practice improved dramatically by having checklists, right? So
Mhm.
now before any surgeries, there's a checklist: name, date of birth, where are we doing the operation, so location. You count all of the tools before and after the surgery. It dramatically reduced any issues and complications in surgery by having checklists before and after the surgery. So,
Or for example, which limb is being operated on. I think I read in that book that, that's very unfortunate, but in some of these surgeries, the wrong limb was operated on, and that,
yes, can you
here
imagine?
a small checklist can make a huge difference. And yes,
Exactly. Yeah. Yeah.
exactly. So
Yeah.
the other thread I wanted to pull on here, while was still on your number one tip, is you mentioned building a cohesive team, or an integrated team. There's
Mhm.
that word again, integrated. So I feel like that's on the minds of any practice manager out there, right? They're all leading teams, leading an organization, trying to keep everybody organized and integrated. What's your advice for that then? What have you seen that works? Do you have any particular tactics or techniques that help with that?
So, ultimately, it has to be genuine. You have to
Mm,
really believe in what you're doing. You have to believe in, the type of medicine that's being practiced, how everybody's working together, the workflows that you're creating. You should believe in them in the sense of like, you want every single member of the team to feel equally valuable, because every single component of that workflow is equally important, right? So it's just as important how the patient feels greeted at the front door as to how they feel leaving the room after the exam with the doctor, right? So they need to feel that same energy in terms of being caring, compassionate, kind, engaged, present, all of those things with every single person in the practice. And so I think the key there as a practice manager would be to really make everybody feel like their job is important and that they are valuable to that workflow.
I'm tempted to dig just a little bit deeper into this. So, how do you instill that within your team without it sounding, empty, right? Because you can remind them of the values every day. You can have them recite them every day. But how do you make it actually stick?
Well, I mean, it's different for me. I'm the founder of my practice. So it
Right.
is genuine when it's coming from me. I'm like, this is why I built the practice. This is how I want the patients to feel. And so, that's something you really can't manufacture and you can't teach. So you have to hire a practice manager or be a practice manager that truly believes in the practice fundamentally,
Buys
right?
into the
So,
mission. Yeah.
yeah, you have to really like, I'll give another example. One of the main things that I love about my practice and the way that it's designed and developed is that it is specifically trying to solve certain problems in medicine, one of which is that people I don't have enough time with their doctor. So our visits are a bit longer than they typically would be if you were going to
Hmm.
see a doctor through a hospital system. And that's because I want to make sure that we're not rushing, that all the questions get answered, that we have time for everything that the patient wants to address during each visit. So everybody that's working with me understands that. And so, when we're working together with patients, somebody shows up late or something like that, like it's not a big deal. We work around because we're here for the patients. And so that's like the ethos of the practice. And so it really stems, from the top drop down to everyone in the practice to have that same energy and zeitgeist. And so ultimately for a practice, I think it's important that everyone is centered around the type of medicine that's being practiced and sort of why you're there, right? All and so it's different in every practice. I'll give another example. If you had a practice that was, let's just say, a pediatrics practice, okay?
Okay.
Kids have a whole different set of things that have to be kind of dealt with within a visit. But making sure that all of the rooms have stuff to help, engage the children and patients when they're waiting, when they're in the waiting room, all that kind of stuff. Like if it's a patient-centered approach in the practice, then that is going to be, sort of how everybody approaches everything from the patient experience from when they walk in the door to when they leave. So there's another example of how I think everyone has to be aligned with what the experience is meant to be for that patient.
Okay, I love that. I love that. And thank you for expanding on this and for providing more detail. So next, I would definitely love to get more into the specifics of your practice and how you help people at Health Meets Wellness. So I guess we would say that you are in the weight management, weight loss space. One thing that I gathered from looking at your practice is that you really go in depth with like one-to-one care with patients.
Mhm.
And I had a question about that is at the same time, you're in a space where I feel like there's a lot of demand, especially these days, perhaps with GLP-1 medicine in the picture. So I imagine that the demand is quite high for this kind of service. So, and yet you're mentioning that you have these kind of longer visits, not rushing, going in depth. How do you strike that balance and make it sustainable when the demand might be quite high?
Yeah, so I mean, I think it's a couple of different things. One, it's the expectation in terms of what is expected in the visit. So,
Uh huh.
knowing that you have a little bit more time during the visit, sometimes we'll do a lot in one visit in the sense of, so I'm also internal medicine by training. So, we do some kind of general primary care. I don't just focus on weight management, although that is the core of the practice. What we also do, though, is treat all of the diseases or conditions that are associated and related to weight. And so, what will happen with that is that then you are striking a balance, but you're able to kind of do a lot and wrap a lot into one visit because we can address a lot of things in that time that we're together where we're really focused and engaged. So, what that means is that it makes the follow up a little bit smoother and easier because we've addressed a lot in that visit. So, there's a way where you can still be delivering, I would say, excellent care to a good number of people, but you have the expectation of sort of what's gonna happen when you're in person and then how that follow-up is gonna go so that there's better time management in between the visits as well. Oftentimes, when you have a quick visit, you're not able to kind of cover everything, so then there's a lot of things that
Mm,
are kind of left where you have questions after, lots of follow-up, that kind of thing. If you're able to kind of wrap everything up in one visit. Now, that's not to say that there's not follow-up. Of course there is, but the expectation of, like,
right.
how that follow-up is gonna go, making sure that there's adequate time for questions, it makes it a lot smoother all the way around.
I see. So it's like a fuller package instead of doing a piecemeal visit by visit, separated by, a couple weeks in between.
Exactly.
Uh, I can totally understand that.
The other
And
thing too, sorry, just one other point is that
of
so
course.
because we have the practice app, so the mobile app was designed and developed to help be those touch points in between visits. So I'm sorry because I think I wanted to kind of mention that just because it is actually a really kind of key component of the practice is that we're able to communicate kind of seamlessly and I can see what's going on in between the visits. So we have meal plan tracking and food tracking through the app. We have exercise tracking through the app. We have medication tracking through the app, and we have health coaching and a direct chat. So, with that, I can see a lot of what's going on in the background in between visits. So, that also helps because then every time that I'm meeting with a patient, I know what diet and lifestyle changes have happened for the most part. I can see how they're feeling on the medication. And so we have a lot
Mm,
of these kind of touch points where we have a lot more information to kind of talk about, modify, and all of those things during the visit as well. So that's a key component. Other
yeah.
visits, other doctors' visits, like I'll just give the example of a general primary care doctor. Typically you see them once a year, and if you're sick, it's very different, right? Than sort of being able to
Mm.
see all the components of diet and lifestyle and everything in between those visits.
I guess let's just jump right into it when it comes to the mobile app, then, because that's definitely one of the pillars of the conversation that I wanted to have with you today. Tell me and the watchers and listeners more about the mobile app. How did that start? How is that helping with the overall, arc or the process of taking care of the patients that you've got under your care?
Yeah, the app is something that I'm very excited about.
Uh-huh.
We designed and developed the app a few years ago, so it's been in production for a while. We're always refining and trying to make it better. We're very excited. I'm very excited about being able to now launch a free version of the app. So the free version of the app is going to be live this week, and so this is something that yes, this is something that's huge. The key components of the free app are all of the accountability components of the app, meaning it tracking. So tracking exercise, wearable tracking, nutrition tracking, as well as health coaching, all of that and medication tracking. So all of that is going to be available for free through the app. And so one of the things that I really wanted to do was to expand access to these components of the program that I designed and developed, and also just I would say to resources to help in terms of reaching more people. So, one of the one of the fundamental components of medicine that is challenging is that there's a bottleneck with how many patients I can see. So I can only
Of
see
course.
so many patients per day. I can only reach so many patients. I'm a human being, so I have limitations, right? However, I can expand access to a lot of the things that I think are really meaningful and can move the needle for people's health through this app. And so that's one of the reasons why I'm particularly excited about it, because I think that there's a lot of good data that just tracking alone can help move the needle and move outcomes with overall diet and lifestyle change, which is quite hard for a lot of people. And so I'm very excited about that.
Yes, yes. I can tell. Is that the TouchCare Method app? Is that the name?
Yes, yep, that's the name of the app, TouchCare Method, and so we have different components in the within the app. So there's the free version, and then if you wanted clinical care, it's available in the United States. You can have access to dietitians, physicians, nurse practitioners, as well as GLP-1 medication.
Okay, great. Just wanted to fill that in. Of course, we'll drop a link in the show notes. By the time this episode is out, the app, the free version of it, should be as well, according to what I just heard. So that's very exciting,
Yeah.
and we're happy to be part of the launch then, in some respect. And what I wanted to ask next is then, could you take me into the specifics of what practicing, how it changed, with and without the app in the picture? How do the patients react? How does that change how you approach the process as a provider? Just a before and after, I guess, or and just more specifics of how it works.
So when I opened the practice, I actually launched the app. So I've
Ah,
been
I see.
practicing with the app, but the app has evolved dramatically over time. So when I know when I say when I started practicing on my own. Previously, I was working for other companies, and so they had their own apps or their own ways that we would
Hmm.
communicate with patients. But when I started my own practice, I actually launched my own mobile app. And so one of the ways that I would say that it really helps in terms of facilitating not only patient care, but just the experience overall is that there are more touch points, as I was mentioning before, in between visits. And so that really, really helps to strengthen the not only the relationship that I have with my patients, but also the insight that I have into what's happening from, the time that I see them to the next time I see them. And so that is really meaningful and really helpful. People generally tend to over-report how much they're exercising and under-report how much they're eating. It's just the way that
Hmm.
people are. And so it's
Human
really
nature.
helpful when
Yeah.
you can kind of shine a lens on what's actually happening. And sometimes it's just as simple as swapping certain things out, making some very small changes. For example, getting off one subway stop earlier, on your way to work, getting 10 more minutes of walking in every day. By the end of the week, you've done 70 minutes of walking or over an hour, right? So these little things can really move the needle. And so those are the types of things that I try to focus on. I really try to meet my patients where they are. So, if there are certain components of their life that are not going to change, me telling them that they need to change them is not productive, right? So instead, it's like, okay, what can we do to build in some things into your lifestyle that you will want to maintain in the long run? I'll give an
Yeah.
example.
Yeah.
Like what's your favorite food? Favorite kind of food?
My favorite. My favorite food? I really like quesadillas. Probably not the best example health wise, but I do love them.
Okay, so this is a good example. So let's just say for an example that you have high cholesterol, and I'm like, okay, you know, you should probably cut down a little bit on some saturated fat, maybe cut down a little bit on dairy. You love quesadillas, that's kind of a cheese
True.
heavy item. So I would say that if you love them, you're not going to cut them out completely. You can do anything.
Mm,
Most people can do anything for a short amount of time, right? You could cut quesadillas out for 2 months, but eventually you're going to want a quesadilla again. You really like them. So
it's true.
yes, so instead of saying I want you to eliminate quesadillas altogether, I would say limit them to once a week. And then there's
Mm.
something that's sustainable there so you don't feel like you're depriving yourself of something that you love. That's just an example, but things like that where I wouldn't necessarily be able to have that level of insight into lots of different facets of somebody's life. I have now more insight because I can see what's going on with the tracking in the app. And so it's really helpful and meaningful to make these little changes that actually can make a big difference in the long run.
I'm tempted to ask, have there been any obstacles that you've seen with adoption of the app by patients? I imagine some aspects of it are quite easy, right? You're wearing your Apple Watch either way, hook it up to the app, and we'll get the data. But for example, for meal tracking or stuff that's more manual, do you ever deal with this? I mean, I'm asking partially because we're in the AI space. We have these AI medical receptionists, and adoption is a big part of the picture, right? Getting patients used to it, getting practices used to it. This is a different kind of software for a different kind of purpose, but I wonder how you're dealing with the adoption aspect of it all.
Yeah, it is, I would say, a challenge in certain respects because it's a habit, right? So it's sort of
Hmm.
and it's
Hmm.
and it's also expectation. So it changing those two things kind of together in terms of, oh, okay, now in between visits, I'm expected to to engage, right? To use the app, to
Yeah.
track. That's a behavior change in and of itself, right? So that's definitely something that can, I would say, pose some challenges. However, I think the key with adoption in general with most things is twofold. One, it has to be simple and easy. You have to remove the friction and make it
Mm,
easy. And then set and like make it the default. So it's just so easy that you kind of can't not do it, right? So there's that. And then the second thing is there has to be some kind of benefit, right? So like what's the carrot? Why is somebody going to do it? Because me just asking somebody to do something is not as meaningful as if I say, for example, if I just told you, we'll go back to the quesadilla example. If I just said, you should stop eating so many quesadillas, only eat them once a week, you'd be like, okay, why? If I say, okay, you have high cholesterol, so we want to make this change so that we can improve your overall health, there's a lot
right.
more meaning behind that. And I think you'd be much more likely to make that change.
Yeah, connected to outcomes. I can
Right.
definitely see that. Does this okay, now I'm asking out of curiosity, is there also this element of access to your physician? So does the app have like a messaging component if somebody's having
Mhm.
struggling with keeping to their program? Is there like help available in between visits?
Yep.
Okay.
Yeah. So that's
Okay.
another component as well, for sure.
Yeah, yeah. Because I was curious about that. I guess, I'm curious about a few things within this whole space. Let me ask you about something else. I can definitely see this aspect of using wearables and using, this whole software layer as some people are already used to using apps for tracking their meals, for weight management. That's something that they've already done irrespective of visiting the doctor, right? I'm wondering if you're seeing from practitioners in other spaces, are there now being developed these kinds of apps for other purposes as well? Because right now I'm seeing, I'm talking with you and you're helping with weight management, and that's something that's quite natural. I do wonder if there's a future where there's going to be an AI coach in your phone from your cardiologist or urologist or for some other specialties where, for any aspect of your health, really, you can use a relevant app, talk with a relevant AI. And I wonder if that's already something you're seeing in the space, seeing how you're closer to it than I would be. That's something that's being done.
Yeah, I would agree. I think that it's coming for sure, and probably even more comprehensively even than you just described. So probably one health coach that integrates all the specialties.
And also, sorry, go.
No, yeah, I was gonna say, so our that the one thing I would say is that we have our AI health coach in our app, and one thing that has been harder for people to adopt to, so there's been a little bit more of a barrier, honestly, until more recently, I think just because of the nature of AI and how it's changing kind of generally, is that our health coach has the ability to do two things. One, you can type or talk to it. Is there and so sorry, type or text it, and then the second is you can
Hmm.
talk to it. So we have a
Oh,
really great interface where you can talk to the health coach, and I thought, "Oh, everyone's gonna love this. It's amazing. It's so cool. It's hands-free. It's really engaging. It's personalized." But people have been texting more and they haven't adopted to the talking. I think it's happening more because people are more used to being able to talk to AI, but that was something that took a little bit more time for adoption than I would have expected, and I think it's because of the expectation in terms of, like, what people are really ready for and what people are ready to adopt. Have you found that with the AI agents in terms of, like, the realistic that they sound, the more likely someone is to probably engage with it?
definitely. Thank you for asking. With our AI agents, it's definitely a big consideration for the practices that we work with, that the voice sounds natural, that it responds quickly. And, on the one hand, you don't want to. I feel like, with AI voice synthesis, we're past this uncanny valley moment where
Mm,
they used to sound like close enough to real, but not quite there yet, where it was unsettling, right? Right now, in many cases you can't tell, which is why we have our AI assistants introduce themselves as, I'm Jessica, the AI assistant, I'm
yeah.
Zoe, the AI assistant, just to remove any doubt, right? Because you want to, at the end of the day, you want to know. But yes, definitely that's something that we found. On the subject of those channels of communication, though, we've also found that some people just prefer texting. I feel like it's a matter of personal preference. It also depends on what you're discussing. Sometimes you would prefer to just discuss in text, maybe a little bit
Yeah.
more private.
Mhm.
So we introduced that as well, right? So you can use texting to talk with talkie agents. You can use web chat to talk with talkie agents because for certain things you would just prefer that, and it's also, I think, a personal preference thing.
Yeah, it is. It's interesting. It's definitely a personal preference thing. And like you said, it kind of depends on where you are and what your lifestyle is like, if it's easier to text or easier to talk.
Yeah, exactly. Exactly. And the reason I'm digging so much into the app aspect of it all is that I'm hoping that, with this episode, we might inspire some change in the practices that we speak to with this show, that they might get interested in this sort of aspect. So
Hmm.
you were saying that you're building this app for your practice. Did you build it from scratch? Was that the case?
Hmm.
Okay. And I wonder about I guess the lift of it, how difficult it was, and would you say to other practices, that it's worth it to invest in this area, in this layer, because that change is coming and they should get ahead of it. What would you say to practice managers about this aspect of like digitizing parts of the care?
Yeah, I mean, I would say it's been very, very beneficial for me overall. I would say it's been a lot of work. And
Uh-huh.
so, what I would say to other practice managers or smaller practices that aren't part of larger healthcare systems, instead of building out your own app, I would say, come talk to me and we can white label our app for you. Because
Ah,
that
I
will be
see.
much easier lift than building it all from scratch. I mean, it's taken me years to do it. It's not something that I think can happen overnight, even with the speed at which AI is working now to be able to create apps. A medical app is more complicated and nuanced than some other apps. So I
Definitely.
think, especially with just, privacy concerns and things like that, and components of medication prescribing, you can't really afford to have mistakes. You can't afford to have a break. It needs to be done in a really thoughtful, meaningful way from the beginning and intentional in terms of what that user experience is going to be like. So I would definitely say using an app is a key component that everyone is going to expect as a consumer. And a lot of the medical apps are kind of antiquated now from the larger hospital systems. So I do think that getting ahead of the curve is important. But if I were a smaller practice, I would say try to find an app, for example, like the one that I built that you could work with, as opposed to building it from scratch, because otherwise you're gonna be a few years behind even getting started, right? Because it's gonna take some time to get the app to a place where you really want it.
Yeah, yeah. And admitting to perhaps my bias here, I would say the same is that we speak with practices regularly who gave it a go in terms of building their own software for the front desk, right? For front
Mhm.
desk automation. And maybe they had some promising results initially, but, building the app is one thing, but maintaining it, bug fixing, adjusting it to
Yes.
different kind of processes, and making sure that it keeps working, that's a lift in itself, and then they come
Right.
to us to actually find a solution that's being maintained for them.
Exactly. There's a lot that goes into it, and ultimately, like, you want it to be adding to the overall experience, and you want the juice to be worth the squeeze in terms of how much you need to put
Right.
into it to get back the benefit.
Yeah, exactly. And the nuances, especially, in these front desk conversations. Well, not especially, but it's one of the cases where, the nuances just keep piling up, and it's good to have somebody who you can just directly talk with, and they're responsible for that part instead of
Yeah.
it being something that you do, a hackathon on or something like that, but then you can't revisit for a while. So, yes, there's definitely an advantage to that.
Yeah, and I think also, so a couple of things as technology evolves, everyone can't be great at everything, right? So if you're a practice
Mhm.
manager, you're managing people, you're managing the practice, you're managing the patient experience, then are you also going to then be the tech admin as well? That's like another thing, another layer, another skill set that you're, adding to their day and time in terms of then going through and making sure that everything's working well and communicating with that. That's a lot. So much easier to partner with someone whose specific skill set is technology.
I'm curious about something else also related to this, not just the digital aspect of it, but I'm curious about the role of devices in all of this. What I mean is, the wearable smartwatch or the digital scale. How are you making that also a part of the equation in terms of, well, for your case, the weight management process. Could you tell me about, like, or bring me into the details here of, like, which kinds of devices you're leveraging, how you're leveraging them, that somebody might have at home, so just so we can have, like, a full picture of what's being done here?
Yeah, so we actually leverage a couple of different devices through our app. We do continuous glucose monitoring through the app. We use home
Oh,
body composition scales. Those are one of the cornerstones of our practice. We do remote blood pressure monitoring, and then we do wearables in terms of, for example, you mentioned the Apple Watch. So we fully integrate with Apple Health and Google Play. So we're at Apple Health Kit is what it's called, and Google Play. So like any of those integrations we work with in terms of getting sleep data, heart rate data, all that kind of good stuff.
so when the visit happens, you just have the data there already. How do you then talk about it with the patient to make them introduce changes?
Well, it depends on I would say the focus of the visit in the sense of, so if we're doing
Uh-huh.
like a primary care visit, we may focus more on some other components like sleep. I mentioned, for example, we may be focusing more on blood pressure. For a weight management visit, usually we're going to really focus on the body composition scale. I like to focus on muscle mass, body fat percentage, things of that nature, so that it's not just focused on the weight or number itself, but more holistically on body composition and overall wellness. So I really like to tie that in. And then usually I'll use other metrics in terms of movement. So step count or exercises that they've logged, things like that that you can get through wearables. So it kind of depends on the focus of the visit, but I like to merge everything together in a way that feels personalized because it is, for each patient and sort of
Right.
what their needs are, what their conditions are.
So now that you've got this, the data is much more available now.
Mhm.
And you mentioned that you're doing, longer visits where you go a little bit more in depth. What do you think is left as kind of the larger challenge within this weight management space? What do you think is like the next frontier of, okay, we used to have this problem with data, collecting it, and and making sure that it's reliable. You mentioned, under reporting, eating, over reporting, exercise. So what do you think is like the next puzzle to crack within this space, or what do you hope the next trend might be?
I think ultimately we have to address ultra processed food.
Oh, okay.
That has
Tell
to
me
be
about it.
something that's addressed in general, right? So ultra processed food is very bad for everybody's health, metabolically, from an inflammation standpoint, and also from a weight standpoint, right? So the food that we eat is a critical component of our overall health, not just weight. And I think that while the GLP-1 medications are very, very effective, diet and lifestyle is very, very important for weight, but in overall health, I think also the food that and when I say diet, sort of like how you're eating and what you're eating, but then to dig into that even more, I think the ultra processed food that's kind of permeating everybody's diet now is something that really needs to be addressed. So as more of like a root cause issue, as well as I think kind of sometimes how we view healthy food, meaning there's nothing that replaces home cooking. And when you eat out,
Hmm.
and eating out is great and it's tastes good and it's fun and it's social and all those things, but really kind of understanding what's in your food, where food comes from. Where a lot of people are very removed from that food chain now. And I think that kind of going back to that is something that needs to be addressed. And it's starting to happen. Farm to table restaurants are very popular. People are into organic and all these, different kinds of components of food that make them healthier. I think it's important to kind of go back to that and to those roots. So that's really something that needs to be addressed with obesity overall.
You mentioned along the way GLP-1 medication, and I wouldn't want to close out this episode without touching upon it just
Hmm.
at least a little bit. When I'm thinking about this topic, I mean, correct me if I'm wrong, but it feels like a lot of people are now thinking about GLP-1,
Hmm.
talking about it. There's a lot of information out there, and a
Yep.
lot of it I imagine is also misinformation, right? And I'm
Yep.
wondering, from the perspective of somebody who is definitely, at the front lines of this, how are you dealing with the education aspect of it all? How are you making sure that your patients know, the benefits as well as the risks and have a clear and real picture of what these medications do and how they should be used?
Yeah, so I think there is a lot of misinformation out there. I think one of the components is access. And so a lot of patients
Uh huh.
are, or people are seeking out compounded versions of the medication because of cost and access overall. So it used to be a supply issue and a cost issue. Now it's more of a cost issue because the manufacturers have increased supply. But, specifically, I saw this morning actually in the news that there are generic versions of semaglutide now available in India for $14 a month, which is going to be groundbreaking in terms of if these medications are really available at an affordable price for people, that will change the landscape of weight management drastically. And so I think that that's something that needs to be talked about in terms of safety, efficacy, and having the guidance and oversight of a medical professional when taking these medications. So that's a key component, just kind of in terms of education overall, understanding, like you said, risk benefits, how to take it, how to go on or off the medication, monitoring that needs to happen when you're on the medication, having the right diet and lifestyle components in place so you can maintain the weight that you lose and maintain the health benefits. Those are the pieces that are really important beyond what people might see in media or in news or, hear from a friend in terms of just losing weight, right? That's part of it, but it's not the whole picture.
Let's see. So, do you often find yourself having to deal with patients coming in and their heads might be filled with, myths about GLP-1, or they're coming in with these, you know, built-in, objections or concerns? I just wonder how you keep them, well informed, also in between visits.
Yeah, so, I think it not to go back to the app too much, but to go back to the app,
But
I think that's
yeah.
one of the ways that we're able to communicate with our patients a lot in between visits, answer any questions, we monitor their symptoms. So there's a lot of those touch points there that help with all of the things that you kind of just mentioned.
I'm just wondering what these conversations might be like, day to day, because I imagine if somebody was coming to me and having, maybe they read a lot about the risks, and I don't even know, well, that's actually probably a better question to ask is like, what are the conversations like these days around GLP-1? Is it that there's just a lot of demand and people have heard mostly positive things and going for it? Or is there more, they're worried about it?
Well, I think I'm seeing a biased population, right? Because I'm seeing people that are coming to me for weight loss. So, in terms of general conversations that might be happening around GLP-1
Right.
medication, I'm not sure that I'm getting those conversations because I'm getting people coming to me saying, I want to take
I
GLP-1
see.
medication, but I've heard X. Or, I'm trying to lose weight. I've taken a GLP-1 and this happened. So I'm getting very specific, kind of like niche questions about it, or questions where someone wants the outcome of weight loss but maybe has concerns, so they may be more likely to either want to take a GLP-1 medication, to want to talk about other options or alternatives, as opposed to just kind of like generally what people are saying about it. Do you know what I mean?
I do, I do. So you mentioned I want to take it, but I've heard X. What are some typical X's that they might have heard?
So there are, I would say one of the things that I have heard from patients is that they'll have friends that have been on the medication and they lose weight too quickly or they lose too much weight. That's a concern that I've heard, and I
Oh,
think that
concern.
that oftentimes happens when there aren't the right diet and lifestyle components in place, and so what happens is you lose too much muscle, and so then it can change your kind of physique overall. You can also lose weight in an unhealthy way, and so, if you're just losing weight by eating less, but still eating unhealthy food and also not making the other changes with, like, strength training, getting enough protein, that kind of thing, ultimately, it'll change your body metabolically, and over time, that may become visible.
Yeah, and I guess that does come back again to the data layer, right? Because you're tracking
Mhm.
not just meals you mentioned, but also workouts. I can see now how that connects, where it's important to keep your muscle mass up as well. Otherwise, I think I
Yep.
saw you posting even on LinkedIn that you might lose too much of it, right? If you just
Exactly.
cut like that.
Yeah,
All
yeah,
right.
and that's one of the keys, and that's why having that oversight and guidance is really important so that you can stay on track, and then I always say to my patients, like, my goal for my patients is not for them to lose weight, it's to lose weight and keep it off. Because if you lose weight and regain it, you're not getting all the
Yeah.
benefits of losing the weight, right?
Yeah. I wonder what that looks like then. Do you think I guess it's just they stay under your care for long term, right? So there might be more frequent visits initially to kind of lose the weight, but then to keep it off, the app itself probably not enough and just check in like every 6 months, every year.
Well, so it's twofold. It's patient specific, depending on if there's other conditions that we're managing or, discussing and talking about and what kind of capacity the patient is seeing me. But I would say that generally the app should be enough to help in terms of maintaining the
I
changes
see.
in between visits. But seeing a physician such as myself, let's say at least once a year to monitor other markers of chronic disease, not just body composition, but to do blood work, to check your blood pressure, all that kind of stuff is something that should be happening kind of regardless. And then, I would say having one more touch point at least in there. So probably seeing someone twice a year, especially if you're managing any other conditions, would be like the minimum. If there's other conditions that are being managed, and then seeing somebody more frequently, even for a telehealth visit to check in, is really meaningful. But the app, like I was saying, provides a lot of touch points. So it really helps to continue that care even once the goal is achieved.
I like that. Okay, I like that.
Yeah.
Especially since I mean this is something we've been talking about even, in our in our marketing or like in our message to the world at large is that it's not about, are is AI going to replace humans in certain kinds of works, but it's certain kinds of work, but it's about collaboration, right? You check in with your physician every 6 months, for example. In the meantime, the AI supports you, the app supports you, the software supports you, and there's a place for both. And I think that's where the productive conversations happen, not in terms of like AI doom or AI utopia, but somewhere in between is typically
Exactly.
where the productive conversations happen. All right.
Yeah.
Doc, Dr. Edens, I feel like before we close out this episode, I would just have one last question for you, and that's coming back to the because I'll admit, okay, I followed my curiosity a little bit in this particular episode, and maybe not all of it was specific to the life of a practice manager, but I wanted to add in one more piece for that kind of audience. So what is something that we either haven't mentioned or maybe haven't emphasized enough that you would say to a room of 200, 1,000, 2,000 practice managers that you wish for them to start doing, stop doing, pay more attention to, get ahead of the trends, or anything like that, related to our conversation or unrelated?
I think in terms of utilizing AI in a meaningful way in practice, it's understanding what the pain points are in each practice and then trying to figure out a solution that's scalable and also helps to take work off of everybody's plate. For providers or physicians such as myself, charting more messages and things to respond to is burdensome over time. And so figuring out a way to leverage AI to reduce that and to reduce the workload outside of the time that people are spending with patients is the ideal, because ultimately I think that everybody really, for the most part, is in medicine for those patient interactions, right? Whether it's someone at the front desk or someone in the back, even let's say an x-ray tech, for example, like they're there for the patient. And so ultimately it's like, how do you remove the admin work and utilize AI to do that so that people can be more present for the patient to patient interaction? Or patient to person, sorry.
Yeah, yeah,
Sure.
definitely.
Yeah.
Yeah, I understand. So That definitely tracks, and we're happy here at Talkie that we can be part of that solution, right? If the front desk is overburdened, we can help with that. What you mentioned, charting, there are AI scribe solutions for that as well. Some of the EHR systems have that built in right now, and there
Yeah.
are other, vendors that just specialize in that. So that's definitely something to look at. I feel like that's one of, those two are probably the highest leverage points right now to look at, and that's why these industries are getting so big right now. Thank you for adding that in. And, mindful of the time that we have left here, I would like to ask you, where can people find you and follow you to learn more about what you do? Perhaps make use of your services if they're in the area, or anything else that you would like to plug on the show. Let's hear it.
Yes, please download our free app at touchcaremethod.com and find our supplements also through touchcaremethod.com. We have a creatine chew, which I'm very excited about, 5 grams of creatine in three
Oh,
chews, no powder, no mess. It tastes like a sweet tart sweetened with fermented stevia, only 6 grams of sugar, easy to take on the go, highly recommend. And then we have a multivitamin that is specifically formulated for people on GLP-1 medication. So check us out, touchcaremethod.com. You can see the links to shop our supplements and to download our free app.
okay, awesome. Thank you. We'll put that in the show notes as well so that you can easily find it, watches and listeners. So definitely check that out. I would say also follow Dr. Edens on LinkedIn. I've seen you there. I've seen you posting. That that's another great thing to do, and we'll put that in the show notes as well. For this show in particular, if you enjoyed our episode, definitely subscribe on YouTube, like and follow us on, and rate us on the podcast platforms. Every little bit helps. We're still, building a snowball as we go here on scaling practice management. Although we're picking up more and more steam as we go along. So I'm happy to report that, but you can always do your part. You can always help, and I hope you will. For today, though, that's going to be everything. Thank you so much for Dr. Edens for coming on the show, for sharing your knowledge. It was a very pleasant conversation. It was great to have you. And for you, watchers and listeners, thank you so much for joining us here today. I'll see you next time. This has been Scaling Practice Management, and we'll talk, or at least I'll talk to you with my guests later on. Bye bye, everyone.